You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello, welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. This is episode 89. In today's episode, I want to talk to you about something that I was introduced to a number of years ago by a number of patients that brought it up, and it was something that I had not heard of and something that I have looked into. I'm not an expert in it, but it's something that I did want to share with you because you may not have heard of this, and it might be something that would benefit you. And what this is called the Egoscue Method. This is a method of treating chronic pain and dysfunction that was created by a gentleman named Pete Egoscue. So Pete Egoscue, if you look back at his history, had spent time in Vietnam and had a bunch of back issues. And I don't know exactly, whether or not he didn't want surgery or couldn't have surgery. There wasn't a surgical fix, but had a bunch of issues with pain and started looking at ways of how he would treat this pain. And this idea that he created to treat his own symptoms has now grown into the Egoscue Method and these Egoscue Clinics. So this was started back around 1971, and now there's over 30 clinics throughout the United States, and they're expanding worldwide. And the idea is to focus on alignment and posture. The Egoscue Method, the way that they describe it is that they claim to be able to help a number of ailments. So whether or not you have back pain, hip pain, knee pain, ankle pain, shoulder, elbow, wrist pain, even migraines, plantar fasciitis, and jaw pain, that all of those things may actually be improved upon by ways that they can help you learn to correct these postural imbalances that many of us do have, but in some patients may lead to chronic discomfort. I mean, just think about how many times you sit at a desk and you might lean to one side and you might tilt your neck in a certain way. All of those things, when they're repetitive over days and weeks and months and years, can lead to changes in the muscles and the spine, and that can cause problems in different areas. So I hear this a lot where someone says, I injured my foot and it resulted in me limping, and now my knee and my hip hurt or my back hurts. And then once the foot injury heals and the limp from that foot injury goes away, the knee and the hip and the back pain resolve because they've changed this postural alignment. But that's something that's more acute, meaning it just happened recently and it went away quickly. But what if you have these chronic conditions that are going on for a long period of time? So he has 3 different levels of trainers that he trains at these clinics. And he goes through the level 1 is this postural alignment specialist, and level 2 is an E-cises therapy skills certification, and then 3 is this advanced exercise therapist. But he has these specialists or these special E-cises. So the idea is that they will teach you a number of these exercises that you can do repetitively to try to relearn the appropriate posture balance, and that you can try to get out of these negative feedback loops that you may have created by having this bad alignment and posture. And this all begins with them examining you and just walking down the street. If you look around at a lot of people, I'm sure that you see a lot of people hunched over, leaning sideways, and they may not recognize when that happens. So when these therapists can look at you and they can use their tools and the instruments, and a lot of this is digital now, they can take pictures and then show you, where is your neck hit, sitting, where is your chin, are you kicking your head forward, is one shoulder dropped to one side, do you have a little bit of a scoliosis, do you have a pelvis that's tilted one way, or maybe, one knee bends in. And again, some of these things may not be fixable in the sense that if you have a bony deformity, that may always be there, but it may be magnifying some of these other muscular imbalances. So what they can start to do is look at these different things and figure out, okay, what are your goals? what do we then want to do based on the deformity that you have to change this? And they can give you these different exercises specific for you and your problem that you can then do on your own. Now, they have a number of ways that you can do this. So you can go into their clinics and see them. There's a number of books. So he has a number of books. One's called Pain Free, I think, which is the classic one, a revolutionary method for stopping chronic pain. The Egoscue Method is a second book, the Egoscue Method of Health Through Emotion, and his other book, Pain Free Living and More. And there's a lot of other books, but those are kind of the big ones, the top three that a lot of my patients have read. But I think for something like this, it's impossible to learn that from a book. I think it would be more worthwhile, if you have the means to set up an appointment with someone, and then you may use that book once you've learned from them on how to do it specifically to delve a little bit deeper, and you might pick up little cues. And a lot of my patients have said that, they've gone in, it's helped them, but they go back for refreshers. So every so often, now that they've fixed those problems, they can go back. And again, this is a good adjunct. Like if you have a specific problem that maybe failed conservative care measures like exercise, weight loss, medications, and maybe there's not a surgical cure, this might be an option. Or maybe there is surgery as an option, but you want to try this first. Or maybe you had surgery and still have some residual things. So, I would not say that, if you have pain, go and just try this. But for some of my patients that were offered a surgery but didn't want to go through with it for certain reasons or risks or concerns, or maybe they saw a surgeon and there wasn't a correctable fix, and they have just these chronic symptoms, you may find ways with these treatments and E-cises and this method that you might find that you can help. And most of these are patients that I've taken care of for their hip or their knee, where they've had chronic back issues, and either back surgery was not indicated or back surgery was discussed and offered, but they didn't want to go through back surgery. And although some of them had a miraculous improvement, some of them found that this helped enough that they were able to then live with their symptoms without having to go through a surgery. So I'll put a couple of the little links in the show notes. But again, just something that I wanted to throw out there in case where you are, you may not have heard of Pete Egoscue and the Egoscue Method. And then you can look around in your area to see maybe if there's an Egoscue clinic near you. Full disclosure, I do not have any affiliation with any of the Egoscue clinics or centers. It's just something that I wanted to share with listeners to make sure that you were aware that this is an option and availability for you. So thanks again for listening. If you haven't already checked out, please check out my book. You can find the Knee Book, A Guide to the Aging Knee, on Amazon, Barnes & Noble, and Google Play. For all of those that you might be suffering from knee pain, I think that specifically may offer you a lot of answers and go over a lot of details and treatment options, from the most conservative and basic treatment options all the way up through total knee replacement and rehab, and really help put you on the path, depending on where you are on that journey, mild, moderate, severe pain, to help kind of clear the air and make sure that you get the appropriate information that you might need. If you haven't already left a review, please leave a review. If you're listening to the podcast, it's reviews like yours that help other people find this podcast. And until next time, stay safe. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.